For over 2 centuries, vaccines have safely minimized the burden of diseases like polio and measles and eradicated smallpox. Thus, vaccination is one of the most cost effective health interventions available today, saving millions of lives from illnesses, disabilities, and death each year. Vaccines are estimated to save 5 lives every minute, and they are among our greatest advances in global health and development. Are you fully vaccinated? Hashtag get all your shots. Greetings, everyone, and welcome to today's show as we celebrate Vaccination Week in the Americas. My name is Tanya Maxwell Major, PAHO Communication Specialist here in the Caribbean region, and I would like for you to help me welcome our guest today. We have Dr. Margarita Gazzelli.
Hello, everyone. It's a pleasure to be here.
It's a pleasure to have you here. And we also have Dr. Peter Figaro.
Hi, and thanks for joining us.
Thank you. Thank you all for being here today. And we want to encourage each and every one of you to share the link, to share the Facebook and YouTube pages. So let me give you a little background about our guest. Dr. Margarita Gazzelli is the Regional Immunization Advisor for Public Health and Comprehensive Family Immunization Unit here at PAHO WHO. And Dr. Peter Figaro is the Chair on Immunizations and is a Professor for Public Health, Epidemiology, and HIV and AIDS at the University of the West Indies in Kingston, Jamaica. And again, it's a pleasure to have each of you here as we celebrate Vaccination Week in the Americas. From the 23rd to the 30th of April 2022, so that's this week, PAHO WHO, together with our countries and territories in the region of the Americas and our partners, we're celebrating the 20th anniversary of Vaccination Week in the Americas and the 11th World Immunization Week under the slogan, "Are you fully vaccinated? Get your shots." So, Dr. Margarita, tell me some things that have been happening throughout the region as we celebrate Vaccination Week in the Americas.
Thank you, Tanya. Indeed, it has been an incredible celebration, starting with the launching ceremony that was held in Dominica this past Monday with the highest political and health authorities of the countries and representatives from PAHO, all partners, and messages from the presidents of Chile, Honduras, Ecuador, and the Secretariat of CARICOM. So really an enormous celebration. And we've been receiving photographs from all countries and territories in our region showing how each country is celebrating Vaccination Week in the Americas. So far, it has been a huge success. We set out to vaccinate around 139 million people across 44 countries and territories, and that is what we are accomplishing this week. And we're not only talking about childhood vaccines or COVID-19 vaccines, as important as they are, we're also talking about vaccines against influenza, vaccines specific for pregnant women or healthcare workers or the military. So really, each country is taking this opportunity to vaccinate its priority populations and closing its immunization gaps. It's been quite a run, and we're thrilled to be celebrating our 20th year this year.
That's fascinating, Margarita. Here in the Bahamas, we've seen our Ministry of Education, Ministry of Health and Wellness, and our PAHO country office also been engaged with the celebration of Vaccination Week in the Americas, doing vaccinations with law enforcement, with children. This is the time for us to encourage persons to come out. During the pandemic, we know that there was a slight decrease with vaccination administration. So now it's the opportunity for persons to come back to the forefront, getting our children vaccinated, getting ourselves vaccinated, whether it's for the COVID-19 vaccine or the other vaccines that are on our schedules. This is the important time. This is an important time to encourage persons to save themselves and to, of course, protect others and saving the lives of others. But let's get into our questions for today. I know that our panel is excited. I can see the smiles on their face. We know that we have passionate people on our panel who are here to help, to educate, to inform, and in a little way entertain us as we celebrate Vaccination Week of the Americas. So our first question to the panel, I'll start with you, Peter. Our first question today is, which vaccine preventable diseases have been eliminated from the Americas, and why is this important?
Well, Tanya, if I could just support what you and Margarita said first, as well as thank PAHO for the support that we've got over the years with trying to improve vaccination in the Caribbean. I think it's important that we do express our appreciation. And we're very proud of the fact that our current director of PAHO is in fact Dr. Carissa Etienne from Dominica, from the Caribbean. So we're very proud of that and appreciate the work over the years. Now, many people in the Caribbean are not aware that the Caribbean has actually led the world. The sub-region has led the world in eliminating several childhood diseases. You know, we eliminated polio in 1982. So that is 40 years ago. Just over 30 years ago, we eliminated measles. So we were the first sub-region to do this. And then in 1994, a disease that many people don't even know what it is, diphtheria. But it was a very serious disease that could cause death in a child. And this was eliminated in 1994. And then, of course, congenital rubella syndrome and rubella have also been eliminated. Neonatal tetanus have been eliminated. So this is what our childhood vaccines have done. So think about it. Most of our mothers, especially the younger mothers, don't even know what polio or measles is. But
true.
Someone of my age, I was practicing medicine, for quite a few years now. And I can remember being in Children's Hospital in Jamaica, being in Port of Spain General Hospital in Trinidad, and seeing wards completely full with children with measles and children dying of measles. I knew persons who were affected by polio and could not walk without a crutch.
Wow.
So many people, younger persons, don't really appreciate how serious these diseases are, the terrible anguish that they brought to parents whose children got these diseases, had to take them to the doctor, and were not sure whether they were going to die or not. So we're very proud of that record. But because of COVID over the past 2 years, what has happened is that our high levels of vaccination coverage of our children with these vaccines has slipped. So we must use Vaccine Week. We must get the children out there and get all of them fully vaccinated.
And it's amazing to listen to you, Peter, as you talk about what you've seen. You've seen the instances with measles, patients with measles, and then having the vaccination, living in a time where we have vaccinations to prevent this and to encourage this. So how do we take the step? Both of you can, Peter, you can continue, and Margarita, you can join in. How do we change the narrative? What can we do to encourage persons to get vaccinated?
Well, it's really important that we learn from our history, we build on our successes, we share the stories. So I would encourage all younger mothers, talk to their parents. The children, the younger people can talk to their grandparents, ask them about these diseases. Tell me about polio. Did you know anybody with it? Measles. Did you have it as a child? I had measles as a child. My brother had diphtheria, because I'm old enough that those vaccines were not being used in the Caribbean at that time. But now, we should not have any of our children ever having any of those diseases now, once we ensure that they are fully vaccinated. And in the Caribbean, in most of our countries, the children have to be fully vaccinated before they go to school.
Correct.
And that is good and important. But Margarita will also share with you her view on this.
Thank you, Peter. No, absolutely. The importance of continuing to vaccinate children is essential. The importance of making sure that your child receives not only a vaccine, but the full set of doses of each vaccines ensures that children are fully protected. And this is true not only for children, of course, but also for adults. There are different vaccines for different times of life. And so it is also quite important to ask not only how can I protect my child, but also how can I protect myself? How can I protect my parents, especially if they're elderly? If a friend or a family member is a healthcare worker, of course, they're more susceptible to the diseases they see in the clinics and the hospitals. So how could we protect them? So
Right.
we want to use this week as an opportunity for really everyone in the family, in the community, to consider the vaccines they have received, what they're missing, and use this opportunity to catch up on all of the diseases, on all the vaccines that they are due for.
Thank you so much, Peter and Margarita. Margarita, I would like for you to take this question. We have a comment here from Gabriella. Hello, Gabriella. Gabriella asks, if these diseases have been eliminated from the Americas, why are we still vaccinating against them?
Two reasons. First, as we have seen with COVID-19, diseases know no boundaries, no frontiers between countries. And there are still many countries in the world where these diseases are prevalent, where polio has not been eradicated, where measles continues to transmit between children. And there is absolutely nothing stopping anyone with this disease to move to other countries or to travel to other countries. And therefore, if a person who is affected, let's say with measles, comes to a country of the Americas where children are not fully vaccinated against measles, that is an opportunity to start transmitting this virus as well. And so this is why we cannot lower our guard and assume that because these diseases have been eliminated here, we are safe from them everywhere. Again, if there's one thing that COVID-19 has demonstrated is that viruses travel across borders. And the second reason is that over the past 10 years in the Americas, we have seen a decline in the portion of the population who is fully vaccinated against these diseases. So even if these diseases have been eliminated in the past, the possibility of them reemerging again, of transmission picking up again, is there because our coverage rates, our vaccination rates as a region are lower. And this is happening in all countries and territories of the Americas. So really, we cannot say that because we live in a specific country where specific guidelines are in place, therefore we are safe. If parents don't bring their children to be vaccinated, if the parents themselves are not fully immunized against specific diseases, that means that all of us remain susceptible. So these two elements are very important to consider, that we cannot consider ourselves fully protected even when the disease has been eliminated here, because it has not been completely eradicated elsewhere.
And that was, you've mentioned some important points, particularly when we think about COVID-19. And as you said, the virus was not confined just to China. We saw how quickly it spread throughout the country. And as travel restrictions change, we've seen here in the Bahamas, we've seen the increase of people traveling throughout the world. And so this is a reminder of us that we must do our part. We must get vaccinated and ensure that our loved ones are vaccinated so we can try to contain and move toward eliminating many of these diseases. So here's another question. We touched it a bit. How has the COVID-19 pandemic contributed to lowering our protection against diseases like polio, measles, rubella, influenza? How has COVID-19 impacted that?
Well, if I could respond to that, Tanya, we all are just coming out of 2 years of intense stress because of the COVID pandemic. You know, we've seen over 6 million people die globally, 1 million in the US, and thousands in the Caribbean. And so COVID has been a pandemic. It has meant that all of us have had to take precautions. The elderly have had to stay at home. We've had to wear masks, maintain physical distancing, and the health providers have had to treat this as a serious emergency and give it their priority attention. Their hands have been full, and we owe them a huge debt of appreciation and thanks. All of us know individual doctors, nurses, and other health workers who have been on the front line looking after persons and have actually died from COVID because the vaccine was not available until well into the pandemic. Mm-hmm. So this has meant that the health providers have been hard-pressed dealing with COVID, and in the Caribbean, our public health nurses, our other primary care staff, the doctors and the nurses, they're the ones who have had to actually help with the COVID, do the contact tracing, look after them. And then when the vaccine was available, a lot of effort has had to be put into vaccinating our population. And these are the same persons who are usually vaccinating the children in the health centers, in the private doctors' offices. So they had their hands full. And of course, parents were very cautious about taking their children to the clinics, to the doctor, precisely because of COVID. So we have a lot of catching up to do. And, it's sad, it's unfortunate that despite the record that the Caribbean has with respecting to be the first sub-region to eliminate all those childhood diseases preventable by vaccination, I regret to say that it is 7 countries in the Caribbean that are the countries that have not met the target set of 40% of our population being vaccinated against COVID. So we have many elderly persons who are vulnerable for severe COVID who have not yet been vaccinated against COVID. And I really want to stress that not only do we need to catch up with vaccine coverage among our young children to protect them against the childhood diseases preventable by vaccination, but we must improve the coverage, especially among our elderly and persons with comorbidities. We must ensure that we improve the vaccination with COVID vaccine among those groups.
Thank you so much for that. Before you continue, I just want to remind our audience to share the YouTube links, to share the Facebook link. This is an important subject as we talk about Vaccination Week here in the Americas, particularly here in the Caribbean. We want you to share the link, share the information. This is vital for all of us. As Dr. Peter mentioned, we need to increase the vaccine coverage in our region. We must. We have to protect ourselves and we have to protect our loved ones. Going back to what you mentioned, Peter, you talked about increasing vaccine coverage for our older folks and also our young, and you mentioned briefly our children. How do we get parents to open up more to vaccinated, to be more willing to get their children vaccinated?
Yeah, well, I think that once we're not in a surge with COVID and the parents realize that there is less risk in going to the clinic, taking the children out, I think, because most of the parents do recognize the importance of vaccination, I think they will bring the children out. And we have to meet them also halfway, because we have to make it as easy as possible for them to get the children vaccinated, and for the elderly persons who have not been vaccinated against COVID, for them also to be vaccinated. I don't know if you want us to go into some of the challenges we face with respect to COVID now.
Let's put a pin on that. We're going to come back to that. But I want to get Margarita into this conversation. Join in, please, Margarita.
Thank you. And here are just a few tips for parents and really any family member who is wondering whether they have received all of their vaccines. So every time you receive a vaccine, you have the vaccination card where this information is recorded. So pull it out for each one of your children, for each one of your family members, really, and take it to a healthcare provider. See which vaccines you are missing. Maybe you are missing the third dose against polio. Maybe you're missing the first dose against measles. But speaking with a healthcare provider to review that vaccination card and making sure that your child, your friend, your parent has received all the vaccine he or she is due for their age can go a very long way into closing this gap. And then, as Dr. Figueroa was saying, in terms of finding the nearest vaccination site closest to you. For COVID-19, there have been many vaccination sites that have been activated, but your regular healthcare provider is probably also part of this network. So they can offer regular vaccines, COVID-19 vaccines. And of course, now during Vaccination Week in the Americas, all of these vaccines are available. So this is a perfect opportunity to take out that card and speak with a healthcare provider and see what you and your family are due in terms of doses, and make sure that you catch up. And, sometimes the vaccination card says that a vaccine is only for children younger than 1, but that child has passed the 1-year mark and because of the pandemic, well, that is really a conversation, again, to have with your healthcare provider. It's not because a child has passed a specific age that they are no longer eligible. With some vaccines, there is some flexibility in terms of age. So again, that's why it's so important to speak with a healthcare provider and make sure that you and your family are fully caught up on all the doses.
That's very important. And we have a question. Oh, go ahead.
Yeah, Tanya, if I could just add, because Margarita is making such an important point, that we can say to the parents right now that a child needs at least 3 doses of polio, diphtheria, tetanus, DPT. I mean, diphtheria, pertussis, tetanus injection. Most of us use the hexavalent that also has other things like Haemophilus influenza, but you need 3 in your primary series.
Break it down for us. Break it down for us.
Preferably before the age of 1, they should have at least 3, and they would get also a polio injection and polio drops, at least 3. And then they would get a booster in their 2nd year of life, around 18 months. You must have 2 measles, mumps, rubella. It's all in one vaccine. You're going to get the first one just around 12 months of age. You're going to need a second one at 18 months before the age of 2. And you're going to get another booster of that DPT and the polio. You're going to get it by age 4 or 5. So if you haven't got those, just take all the children to the nearest clinic or to your health provider and get them fully up to date.
And if I may say a word with regards to COVID-19 vaccines and why we are so insistent on everyone receiving 2 doses. This is exactly the same reason. Without the 2 doses, a person is not completely protected. In fact, now we're talking about additional booster doses to improve the immunity. But receiving 1 dose and deciding that that is enough, it really isn't enough. The person still is susceptible to the disease. So that's why it is so important to finish the vaccination series. As the pediatrician says, it's 3 doses of polio. It is 3 doses of polio. If the healthcare provider says 2 doses of COVID-19 vaccine, that is what it needs to be administered. We all wish we could only administer 1 shot and be done with. For most vaccines, that is not the case. But you need the complete series to be fully protected.
And this is a very valuable information. Now, following with the point that both of you made, we have a question from Mighty. Hi, Mighty, welcome. The question is, I lost my vaccine card. What can I do?
Well, usually at most of the clinics, the nurses are well organized. Go to your usual health provider or go to the usual clinic where the child got the vaccines, and they have it documented. They can fill out a new card for you.
Filling out a new card is not a problem at all.
And all right, and adding to that, Mighty, you heard, go to your healthcare provider, get your card, and get your mark so you can make sure you have all the vaccines that you need. Now, going back to what was mentioned earlier, how can we ensure that we are protected against these vaccine preventable diseases, particularly as adults? Let's say I carry my vaccine card to the clinic and they see that I did not take my DPT vaccine. Will I get this vaccine now, or am I too old to have the vaccine? What happens in that regard?
Margarita, you want to?
Both of you,
Usually,
both of you excited to answer.
These kinds of childhood vaccines are not administered to adults. There may be specific situations, again, in consultation with your healthcare provider, where there might be an opportunity to catch up on some doses, but this would have to be on a case-by-case basis. Usually an adult would not receive childhood vaccines because most likely they have already had some exposure to disease, so they have some immunity already, or they are not their bodies are not they will develop immunity, but it will not be as optimal an immunity as if it were for a child. So again, on a case-by-case basis, but if an adult comes in saying, I have not received my third dose of DTP3, maybe they will not receive it.
Right, but maybe I could add a little bit here, because as Margarita says, you look at the specific disease and vaccine. So with measles, for instance, let's say that there is a child who only received one dose of measles vaccine. Then that child, even if they're 6 years, 10 years of age, even as an adult, they could get another measles vaccine. And they could even get MMR, but they could get measles. And then if you have a child and you're not sure whether they're fully vaccinated with their hexavalent, we can give them a booster of adult diphtheria and tetanus. And in fact, we do encourage adults every 10 years to get a tetanus booster, because if you get a cut or a nail, you walk on a nail, we don't want you to get tetanus. So we do give a booster roughly every 10 years. And what we're doing now is we have an adult version of diphtheria vaccine. So we give adult DT. But what you do is, if you have any question at all, go to your health provider, whether it's your family doctor, whether it is your nurse at the health center. Just go to your health provider, go to your health center, and ask these questions. Don't be afraid to ask these questions. And if the specific health provider needs to check, they will check, because there are older children who do need to get vaccines. Think of the human papillomavirus vaccine. This vaccine prevents girls from getting cancer of the cervix. Yes. So at every stage in our life course, at every age, there are certain vaccines that are suitable for you, including older people.
Thank you both for that. Everyone, you've heard it yourselves. Go to your healthcare provider. We cannot stress that enough. Speak to a trustworthy healthcare provider, not your mechanic, not your best friend who may not be experienced in the field. Speak to your healthcare provider, not your hairdresser. Speak to your healthcare provider. We have a question from Mechi. Thank you for joining Mechi. Mechi's asked, how can we convince a friend that does not trust vaccines?
So maybe I can start. This is a complicated topic, because if your friend is asking for advice, you are obviously, she trusts you. She feels that you are a good source. So be a good friend and send her to and provide her with correct information. The PAHO website is always updated. There are a number of different organizations in the Caribbean, in the region, that can provide the most up-to-date, correct information. And again, your healthcare provider is the most reliable source of information. They are completely up to date. They have been trained on each one of these vaccines, when is the appropriate time to administer them, how they need to be administered. And if the concern is with whether these vaccines are safe, and if safe, there are so many trials that occur both before and after a vaccine is approved for use in the population. And the monitoring continues for months and years after this vaccine is being used, that really any concern is quickly identified, discussed amongst experts, and then a decision is made. But it's not because that these vaccines are approved, then they will never be looked at again by experts. There's continuous monitoring, and agencies and organizations in each one of our countries have been so very careful with the safety of these vaccines, that really a person should feel fully confident that they are receiving the best care possible, the most preventive care as possible. And the same thing is occurring with vaccine effectiveness. Do these vaccines actually do something for me? And that's the exact same process that is followed with the safety of the vaccines. There are studies ongoing both before and after a vaccine is used in the general population to make sure that it is doing what it says it does. So that if you are vaccinated, you are fully confident that you are protected against a specific disease. So again, there are a number of very reputable sources. And of course, again, your healthcare provider. The big concern, and something you should mention to your friend, is that there's also a lot of disinformation, especially on social media, that is circulating, that is passed on as rumors. And those cannot be taken at face value. Whenever you hear something about vaccines and it's something that says that they are not safe and effective, again, check with those reputable sources. If there is a problem or a concern with a vaccine, those sources will tell you. That is our mandate as PAHO, as WHO, to provide you with the most complete and accurate information possible at a specific time. So really, if there is a concern, we will tell you. If it is a rumor that you've heard on social media, check it out. I think that is the best recommendation you can give to a friend if they have concerns about vaccines.
I completely agree. And we want to remind you, if it is that you have any questions about anything regarding public health, you can you can visit our PAHO WHO page, or you can also speak with a representative from the Ministry of Health and Wellness within your country, or the Ministry of Health within your country, to ensure that the information that you have is accurate. Beware of misinformation. If you need the correct information, you can always visit our platforms, whether it's on our YouTube pages, the PAHO YouTube page, PAHO websites. We have the information here, and it's for your betterment. So we want to encourage you. And also, you can always, as we mentioned over and over again, speak to your trusted healthcare provider. Speak to your trusted healthcare provider. We are here for you. We have another question here about the COVID-19 vaccine, but we're going to come there in a few seconds. I had another question about the vaccines. Well, it talked about the appropriate age groups and having to follow the guidelines for the appropriate age groups regarding vaccines. But you touched a bit about it. I think it was Dr. Margarita who'd mentioned taking the vaccines, and there may be an adult version of a vaccine in comparison to the children's version. So we'd move away from the children's version. But is there any other vaccine that we should be concerned with at this time, adults? Or should we just speak to our healthcare provider to ensure that we meet the guidelines?
Always speak to your healthcare provider. But some vaccines that are typical for adults are obviously COVID-19 vaccines. We've been talking about it for quite a while now. Influenza vaccines. If you are pregnant, there are a number of vaccines that you should take, or that you should at least be up to date with. Diphtheria, pertussis, making sure that you are up to date with those doses, that you've received the required boosters, so that you and your baby are fully protected. If you are a healthcare worker who is living in one of the 13 countries of the Americas where yellow fever is endemic, meaning that it is constantly being transmitted, that is also vaccines that you should be taking, because you may be taking care of yellow fever patients. So again, depending on your age, but also your current health condition, and your profession, you may be encouraged to take other vaccines as adult because of the specific risk that your profession or your health condition puts you in. And these vaccines for these specific conditions have been thoroughly tested. So a vaccine recommended for a pregnant woman has been thoroughly tested. And once again, there are safety data and effectiveness data that keep being collected and analyzed to make sure that we are providing the best possible product to these groups who need it especially.
Thank you for that. Remember, everyone, vaccines are safe and effective, and they save lives. I know, Dr. Peter, that you had started to touch on some points about COVID-19 early and the challenges that we are facing. Please feel free to share now.
Okay, but I really also wanted to stress that really the reputation of our vaccines that we use to prevent childhood diseases, their reputation is established. They are highly effective. It's like trying to call Mother Teresa a criminal or saying that Mandela was not a great leader if you're going to be attacking the childhood vaccines. And I think the vast majority of our people know that the reputation of our childhood vaccines is unimpeachable. They are safe and effective. This does not mean that when you're giving an infant a vaccine, some of them do develop a mild fever for a few hours or a day or two. Some of them get irritable for a few hours. I can remember, I hate to say this, goes back to the 1950s when we had 3 different polio epidemics in Jamaica. And I remember my mother there were 7 children. They marched us down to get the polio injection. And we started with the eldest. And by the time we reached the 5th, my brother, as he got the injection, he fainted. Well, number 6 was just lined up and he was revived. He revived immediately because some people, when they get an injection, they faint, right? Nothing was wrong with him. So it's important that we recognize that these vaccines are safe and effective. And it is unfortunate that there is misinformation even about these vaccines.
Yeah.
And so, but I think most Caribbean people know that these vaccines are necessary. When it comes to the COVID vaccine now, the challenge we faced is that many people wondered, how could they develop a vaccine so quickly? They know that it took years of scientific work to develop most of the other vaccines. Most people were not aware that the SARS epidemic that happened about 15 or more years ago in the Far East was also caused by a coronavirus. And that stimulated the scientific community to work to develop a vaccine against coronavirus. Then when they had the Mediterranean respiratory syndrome, which is also due to a coronavirus, that stimulated further research into the preparation of a vaccine. So once the Chinese scientists actually were able to sequence the coronavirus that causes COVID and shared it with the scientific community, it meant that the pharmaceutical companies that had already developed a coronavirus against SARS, but had not actually used it, all they needed to do was to change the sequencing to adjust the COVID virus. And therefore, they were able to get it into animal studies and then into human trials very, very early. And of course, they had to go through the process nevertheless of doing phase 1, phase 2, phase 3 trials. And they also, what helped them is that a number of governments, including the US government, but other governments, foundations, including Gates Foundation, and other organizations, invested a lot of funding to support these clinical trials and rapidly doing the testing that was needed under very close surveillance conditions, very, very rigorous conditions, to identify that these, first, that it was safe and that it was effective. Now, even after these vaccines became available, they only got emergency use authorization, which meant that there were additional conditions for using those vaccines where you had to monitor people closely to see if there were any rare adverse events, rare side effects. And the truth is that, yes, we did see some very rare adverse events. The messenger RNA vaccines, 1 in a million approximately, had a very severe allergic reaction where they anaphylactic shock. But we always have adrenaline injection when we are giving vaccines, and we have antihistamines, a quick injection, and I don't think any of the persons died. Maybe one person died. I don't think any. That's 1 in a million. With the AstraZeneca and later with the J&J, which is a different kind of vaccine, they found that there was a very rare condition, extremely rare, where the person develops very severe persistent headaches or abdominal pain, and they get a very rare blood clot. And unfortunately, some of the persons who got that did die, right? But now we are much more alert to that side effect. And what is fascinating is that although these vaccines, the viral vector, adenoviral vector vaccines like AstraZeneca and the J&J have been given into hundreds of millions of people now, all across the globe, we are hardly seeing that side effect in many of the countries that are using that vaccine. So there are very rare side effects for some vaccines. Another side effect with the messenger RNA is that persons may get a little chest pain and they get inflammation of the muscle of the heart. It's called myocarditis. This is more common in young men. But again, maybe 1 in 100,000, and usually within a day or two, they're better. They've now followed up many of these persons for months, and there is no permanent ill effect that can be identified. So in life, you always have to weigh the risk and the benefit. And as you think about how many people have died from COVID, over 6 million. And in fact, that is just reported deaths. Some analyses suggest that the real number is closer to 15 to 20 million globally.
Wow.
And especially in the elderly people, I can tell you that the Jamaican data show that if someone over 60 gets COVID, maybe they 13 out of 100, 13% of them are going to die, and many more will end up in hospital. So there's a benefit and a risk. So then, of course, the misinformation, but we have to be very, very patient, in my view, and we have to be honest. That is why I'm going into the fact that there are very rare adverse events associated with these vaccines, but you have to weigh the benefit against the risk. And
thank you so much, Dr. Peter. So we have 2 more questions before we wrap up, and you've shared both of you shared such powerful, such valuable information with us. But but we have a question here from our social media, and it says, but why should I get vaccinated if I might get COVID anyway? And this is something that we've heard time and time again. Why take the shot? Why get the jab if I'm going to get it? What would be your advice to the person?
Yeah.
Go ahead,
Well,
Margarita, you were starting.
Margarita, you want to go first?
I'll take the first stab. Thank you very much. No, it's an excellent question, and it's something that is a very justified question. Indeed, we have seen, especially in the last months, people who have been fully vaccinated developing the disease. But let me make a few points. First, I know it sounds like a long time ago, but it was only 2 years ago when we'd had no vaccines. And people were just exposed to this new virus, getting sick, getting hospitalized, dying in great numbers. And all of this because we had no protection whatsoever. Our only protection, indeed, was social distancing and mask wearing and hand washing. That was it. That was the only thing we could do to protect ourselves. Now arrives December 2020, and we have the first vaccine, the Pfizer vaccine, followed by another 8 vaccines that have been received emergency use listing from WHO, plus others who are still in the pipeline for that approval. You will see that the number of deaths and hospitalizations across the world in all countries has dropped dramatically. So even if a person becomes infected, it is now much milder, especially if they have received their 2 doses. If they've received a booster, the infection is most likely going to be asymptomatic, meaning that you have no symptoms at all. If you don't test, you wouldn't even know that you have the disease. So contracting the disease when vaccinated is a completely different scenario than being infected when not vaccinated. Your symptoms are far milder. They may even be non-existent. Obviously, your risk of being hospitalized or dying drops dramatically. And we're talking significant drop in hospitalization and deaths, again, in every country in the world where vaccines are being administered. And also, you might have heard something called long COVID, which is the leftover, is the symptoms that remain with you even after the infection has cleared. And these can last months. We're only 2 years in, so we don't know how many years it might last, but it certainly lasts months for some people. And we have seen that for those who have been vaccinated, these long COVID symptoms are far milder. So again, the vaccines protects you even after you have contracted the disease. The disease itself is going to be quite mild, and the long-term effects, if there are any, are also going to be mild. Now compare that to a person who has not received the full set of vaccine doses or is completely unvaccinated. They are still fully exposed to the full force of this virus, the same way that he or she was at the beginning of the pandemic. Now, maybe transmission of the virus itself is a little bit milder because everyone else around them, hopefully, is fully vaccinated. But that person, once they contract the disease, they are infected with the virus, are still fully susceptible to hospitalization and death. And when they survive, their long COVID symptoms can be quite difficult to manage. And that, of course, affects not only your quality of life, but obviously your employment, your time with your family, every activity that you want to do and that you were just waiting for the COVID pandemic to end in order to enjoy again. So that's why we strenuously recommend getting vaccinated, even if the risk of infection is still there, is going to be far milder. You're going to recuperate a lot more quickly, and you can get back to life as normal very quickly as well.
Thank you for that. Do you care to add, Dr. Peter?
Yeah, I think Margarita has really summed it up very, very well. I mean, there's no question the vaccine protects you against death and severe disease and hospitalization. And in fact, persons who are vaccinated are less likely to get infected, whether infection with mild symptoms or no symptoms. You're less likely to get it. The other dimension, of course, is that the more persons who get the virus and the more it is transmitted from one person to another, the greater the risk that we'll get a new variant
Yes.
of concern, because the vaccine tends to mutate, to change. So that's another reason why it's better to be vaccinated, because the fewer people who get infected, it means hopefully we can start to control this situation where we keep getting new variants of concern that cause new surges of infections and disease and deaths.
And one last thing, if I may add, we have seen 5 variants so far with names Alpha, Beta, Gamma, Delta, and Omicron. There is nothing saying that a new variant will not emerge. And this variant may be more easily transmissible and cause more severe disease. So if you are vaccinated now, there is a much higher chance that you will be protected against any new variant that might emerge that we still don't know about. However, if you're just waiting for the number of cases to rise again in order to take action, then you may be caught up in this new wave, and you will be you may experience the full force of this new variant. And again, because we don't know what this new variant may be, it is quite difficult to be able to prepare vaccines that can respond to this. So again, use this period to fully vaccinate yourself and your family so that you are ready for whatever else this pandemic may bring us.
Thank you both. And before we go, I just have one question. I've seen time and time again where persons who have been vaccinated are not interested in taking boosters. What are your thoughts regarding that? Or how should we encourage persons to get the booster shots?
Let us learn from the children, right? We have eliminated polio and measles in the Caribbean and the Americas, right? It took 2 injections for measles. Everyone had to get 2 injections. For polio, it took 3 in the primary series in the first year of life, plus a booster at 18 months, another booster at preschool. That's 5, right? So let's face up to the reality. The studies have shown that if you get the primary series, usually 2, and then you wait a few months and get a booster, you are more protected against severe disease as well as against getting infected. And the durability, the period that the protection lasts is also longer. So we know that it has been very stressful during the pandemic, and I think this is part of the problem. And it has required a lot of effort to vaccinate people and for people to come forward to be vaccinated. Right. But it is definitely better to get your booster.
Yeah. And I would say, especially if you are a healthcare worker, an elderly person, a person who is immunocompromised, meaning maybe they've just had a transplant or they're taking immunosuppressive medication for whatever reason. These persons are particularly recommended to receive their boosters because the first 2 doses may not have given you the full protection that another person in the general population may have received with only 2 doses. So if you are any of these conditions, a pregnant woman, absolutely receive your 3rd dose. Again, there have been numerous studies and continue to be numerous studies that ensure that these vaccines are safe and effective even within the 3rd, and now we're seeing the 4th dose in some countries. Right. So really this is a recommendation to everyone to, once again, check with your healthcare provider, see if you are eligible for a 3rd or 4th dose because of your condition, and make sure that you get that dose as soon as possible. Let's take advantage of this period of calm to prepare ourselves for what could be a next wave.
Right. Well, let me just quickly say that in the Caribbean, the number 1 priority, in my view, for COVID vaccination is those elderly persons and persons with comorbidities who have not yet got even 1 vaccine.
Absolutely.
Get that first vaccine as soon as possible, and then get your 2nd dose Of course, persons who have already received 2, certainly go for your booster. But we've got to we are still below 50% of our elderly persons. And really, we can do better than that.
That's right. I want to say a special thank you to our guest, Dr. Margarita Giselli, and to Dr. Peter Figaro. I've had such a great time listening to you, learning from you, and to our audience. I want to say a special thank you to everyone. We want to encourage you as well. Visit our PAHO pages, our websites, our Facebook, our Twitter, our Instagram pages for more information regarding public health. And remember, get all of your shots. Get all of your shots. So we also want to encourage you to remember that vaccines are safe and effective. Ensuring their availability for all people contributes to sustainable development, fighting poverty, and ending social inequalities. Thank you for joining us today for a Vaccination Week in the Americas. Do enjoy the rest of your day.
Thank you.
Thank you.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para. La vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansias.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo e me gusta muito.
Eu me sinto muito honrada de trabalhar, porque eu sei que é programa que você tem resultados.
La salud no espera. Vacunémonos.
Vacúnate.
Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts from more than 40 countries and their partners. In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.